Hello and welcome, I'm Mykhailo Zagriichuk and you're watching Head to Head with UATV. Today we're talking about the development of the transplant surgery in Ukraine, which is one of the first priorities for the new Ministry of Health. To discuss this, we welcome to our studio today Mykhailo Zagriichuk, Deputy Minister of Healthcare of Ukraine. Hello and thank you for joining us.
Hello, thank you for the invitation.
Well, it's a pleasure to have you in the studio, but let's first start from the recent news, from the latest ones. Now we have in the headlines the story from Boryspil, which is in outskirts of Kiev, that the personnel of one of the clinics is suspected in performing illegal organ transplantations. What information do you know about this case?
Thank you very much for the question. Of course, we have an information. It was not an organ transplantation. And to be honest, we don't have a case with illegal organ transplantation in Ukraine. It was not true. It was like stem cells procedures which wasn't illegal. And such a publication on TV and in newspapers, this is the worst thing which is push our transplantation system down, unfortunately. So, as an official, I am telling you, it was not organ transplantation. And hope in the future our news makers will be more carefully give us such news.
Well, with better clarifications.
Sorry about that.
But yeah, this is a matter of professionalism. That's why we are asking you to clarify these things for us. But from your words, I understood that there was no illegal organ transplantation around Ukraine. Can it be true?
Yes, it is just impossible. Because if you are talking about organ transplantation, it has to be involved about 100 persons in one transplantation. It is just impossible to take an organ somewhere without being noticed. And to take an organ and transplant in another person, it has to be very big technological process with lots of surgeons, anesthesiologists, theaters. It is just impossible to do it illegally. This is the point I would like to say to anybody.
Well, let's just say that organ transplantation and organ donation almost do not exist in Ukraine. How many surgeries can Ukraine provide annually for the patients that are in dire need of such a surgery? Well,
unfortunately, you are right. For the last year, we did not have organ transplantation from cadaveric donor in Ukraine. And we have a lot of reasons why it was like this. And this is why we came and we start to change these things. Ukraine have a very huge potential of transplantations. We have lots of surgeons and couple of centers where where surgeons and all other members of the doctor's team are ready and already has an experience, because the transplantation from live donors exists in Ukraine. It's not too many cases, but it still exists. For example, in the National Institute of Surgery and Transplantology, Shalimov Institute, we perform from 12 to 14 liver transplantation from living donors per year, the same as a kidney and this sort of stuff. But to have an appropriate transplantation system in Ukraine, we have to develop mechanisms, and it has to be according to the law, where we can develop cadaveric transplantation, and this is the way.
Do we need a special legislation to perform this cadaveric transplantation, and what does the ministry do right now in order to approach this issue?
We have a law which regulates transplantation policy.
And cadaveric as well?
And cadaveric as well. And according to this law, we have doctors or transplant coordinators has to ask the permission in relatives, the person who already died. And this is actually very difficult point. Also, we don't have, as a routine mechanism, brain death diagnosis. So we start to change this right now.
Why is this difficult? You said that the patient should ask for consent of the relatives of the dead person.
Not patient, doctors.
The doctors, right. So why is this complicated in Ukraine, and maybe what needs to be done? Maybe people have to give their consent when they're still alive in order to...
This is the way where we're moving right now. Of course, in another countries like USA, European countries, Belarus, persons when they are alive, they are giving their permission. In case of my death, I give a permission. For example, when you taking the passport, when you're receiving the driving license, during these procedures, we don't have such as procedures in our country, and we now start to create this system to receive permission from the persons when they are alive and they feel well. And basically this is the main point. But for now we don't have such a system. And
should there be some kind of registry?
Of course, we are now creating and developing the special program. Special computer program, which exists in Europe, in USA. It calls YEGIST, like huge system where transplant coordinator will put the data about donors, about recipients, about the citizen who gives their permission. So hopefully in a couple of years we will have such a system, and in case if we have a patient who died and who still can be a donor or a donor for organs, the transplant coordinator can go inside such a system and have a look. Is this person gave her or permission when he was alive or not?
This means that these organ transplantation surgeries will be performed in Ukraine, and Ukrainians will stop seeking for help somewhere abroad.
Of course, because for now, unfortunately, we have a government program for the treatment of our citizens abroad, and 90% of such a program is transplantation. Heart transplant, and it's huge amount of money we are paying abroad.
It's India and Belarus, two countries, right?
It's India, it's Belarus, it's Turkey. If bone marrow transplantation we are talking about, it's Italy, some clinics. So it's a lot of them, and it's huge amount of money. Investing such money in Ukraine, in Ukrainian clinics, in Ukrainian doctors, in Ukrainian nurses, we can receive and develop our own transplantation system.
And would make a healthcare system more sustainable and reliable in Ukraine, of course.
Of course, that's what we are working on.
But how many Ukrainians do need this organ transplantations per year, approximately?
Approximately, it's about 10,000 patients.
10,000 patients need a surgery.
Of course, of course.
And they go to the list of these countries that you've mentioned?
Not that amount of patients are going abroad. Unfortunately, we have hemodialysis. Most of these patients is kidney failure, chronic kidney failure, and they are on the hemodialysis. Lots of patients simply dying because we cannot provide... Transplantation is not only the treatment, it just is the only single option to saving the life. And most of them are dying. Now it is it was very surprisingly for me when 2 months ago we went in the ministry and we went in charge of this situation, and we don't even have single data how many patients with what diseases are in our country. So that's what we have to create in very short time, and what we are working on right now.
And this is tragic. And according to statistics, up to 9 people awaiting organ transplants die every day in Ukraine before their vital needs are met. And after a year, this number totals in 3,000 lives. And of course, this figure is tragic for Ukraine. And of course, now I think it's the right time to discuss the new initiative of the ministry. I know that from the very first day of the next year, the Ministry of Health is planning to launch these transportation surgeries in Ukraine, but there should be some kind of probably preparational work, and also How do you plan to launch these transplantation surgeries? Because do we have enough specialists for that?
Well, we do have specialists for start. But as far as you understand, if we don't have a donor, we don't have an organ transplantation. So the preparation process, what we are talking about right now, is on its way. I mean,
yes, but it's also a risk for their lives. So how many specialists do we have that can perform these kind of complicated operations?
Well, for example, in National Institute of Surgery and Transplantology, we have a lot of surgeons who are now absolutely ready to transplant kidney, heart, lung, liver.
This is great.
All exist. But what we have to do, we have to provide them with organs, with the donor.
Right.
And this is the main problem, because this process, it involved a lot of things which has to be done and has to be done quickly. For example, law regulation, cooperation between our force authority like police, prosecutor services and that sort of stuff, because our doctors are not safe enough. They just scare, because law regulation is not still not appropriate for all this kind of preparation. And the main point, we don't have mechanism of brain death diagnosis, because you are treating the patient like as a patient. That's it. But from some point, you have to perform brain death diagnosis. In case if brain is dead, is ultrasound, in another instrumental diagnosis. If you have brain death diagnosed, since that time only, you can see such a patient as a potential donor.
As a potential donor.
As a potential donor.
We're talking about cadaveric transplantation.
Of course,
right now.
of course. And for now, no one clinic perform the brain death diagnosis as a routine practice.
Why so?
Well, first of all, because there was not understandable enough from the doctors. I mean, we have cases when patients are in intensive care unit, for example, for 2-3 months, half a year.
For quite a long time.
For quite a long time, with brain death happened half year ago. But they are still alive because they are on instrumental, because the machine.
Yeah, because the machine supports.
For example, if our patient is young and organs are not are healthy enough, and it was a car crash accident, and the brain, and our doctors still treating such a patient as a patient, because they don't diagnose the brain death. In abroad, for example, in USA or in Europe, insurance company, they are paying for the treatment till the brain death is diagnosed. After that time, unfortunately, we have to understand that this is not a patient anymore. Unfortunately, the person dies. But in Ukraine, we don't have such a policy regulation, and that's what we try to do now.
So you're trying to integrate this new policy around Ukrainian clinics?
Because it's not the same transplantation and brain death, but without brain death diagnosis, we cannot speak about transplantation.
About the cadaveric one.
Because we have any right to look to any patient as a potential donor before we prove that the brain is died already. This is the first step we are taking now to do this practice as a routine. And another reason why it's not still for now, it needs our intensive care units to be equipped appropriate, and that's what we are looking now. We are looking for the money to buy the equipment to all intensive care units around our countries, because in any intensive care unit, in any time, there should be the patient which can be as a potential donor. after brain death diagnosis. So that's what we are working on right now.
Right now, the Parliament is considering increasing the funds for the healthcare in Ukraine. Will it be enough? Will it be enough of cost to cover, for example, these expenses, to equip the hospitals with the special machines?
There is never enough money, unfortunately.
Yes.
But I hope for the transplantation
This is a hard truth.
it will be enough, because our president and our prime minister is declare that transplantation is our first priority as a healthcare, and hope for this program money will exist for.
And just briefly, in 2020, what is changing since 2020? So now we're developing the registry of people who are giving the consent to become donors after their deaths, right?
Yes.
This starts in 2020. What else? Just briefly, so we can
Just
conclude on
briefly,
these theses, and
I hope in
our audience can
2020
understand.
we will do the law regulation correctly. We will put brain death diagnosis as a routine. We will equip enough intensive care units. We will train another surgeons, because it should be 6 or 7 centers around the world where all kinds of transplantation will be performed. And since then, when only we will have donors, we will start the transplantation around the country. This is our agenda. This is where we want to go in 2020. We will see.
Well, best of luck in completing this ambitious and really needed, much needed goal. Thank you so much for these clarifications, and thank you for being a guest today.
Thank you very much.
That was Mykhailo Zagriichuk, Deputy Minister of Healthcare of Ukraine. Thank you for watching Head to Head. I'm Mykhailo Zagriichuk. Goodbye.